Welcome to another episode of Jas-Health for the people, by the experts, an initiative by Jaslok Hospital in the interest of public health awareness. I'm Jitendra Harian, your host for the show, and today we have Dr. Ameet Pispati, who is a senior orthopedic surgeon with over 3 decades of experience. Dr. Amit Pispati is a director of orthopedics department at Jaslok Hospital. He is internationally trained in joint replacements, sports medicine, and arthroscopic surgeries in UK, Germany, and United States. He's skilled in computer navigation for hip and knee replacements, kinematically aligned total knee replacements with Dr. Stephen Harville in USA, and complex hip and knee replacements in रश यूनिवर्सिटी शिकागो नी रिप्लेसमेंट सुनते ही हम रिकवरी के बारे में सोचने लगते हैं लेकिन लेट मी टेल यू इंडिया में आज 90 to 95% सक्सेस रेट है एंड टुडे वी हैव डॉक्टर अमित पिस्पति टू टेल अस more about it in our Just Health episode.
Thank you so much.
Dr. Pispati, robotic surgery is often seen as future of medicine. And as we know that orthorobo exists for now over 10 years or so, how do you see that robotic surgery has already changed the landscapes of orthopedic surgeries in India?
A number of people have already got robots with them now, but my view is that robots alone are not enough to help patients adequately.
Correct.
What is important is who is the surgeon who's using the robot, what is the experience of the surgeon using the robot, how is the robot being used on the patient, and what is the problem of the patient. All these points need to be taken into account, matched to each other, and then a plan needs to be made for the patient to give a better result to the patient, and that's what gives rise to a successful surgery.
So, doctor, अभी कितनी प्रतिशत रोबोटिक सर्जरी इंडिया में हो रही है?
I think about 10 to 15% or maximum up to 20% surgeries are robotic, but the expectation is that within the next 3 or 4 years, almost 40 to 50% of our surgeries are likely to be robotic.
As we know, robo has been there for last 10 years or so. But 10 to 15% surgery number sounds very less. So, आपकी राय में इसके क्या रीजंस है? और आप ये भी समझाइए कि रोबोटिक सर्जरी करने से क्या एडवांटेजेस, क्या फ़ायदे होते हैं पेशेंट्स को, ताकि लोगों को समझ में आ जाए और शायद ये नंबर बढ़ सके इन फ्यूचर.
One of the reasons why the number of robotics being done right now is less is the investment cost of the machine. Once the machine is in place, then more and more people, of course, want to undergo robotic surgery. The main advantage of robotic surgery is the precision of the surgery. वो काफ़ी accurate surgery होती है. जब हम नॉर्मल सर्जरी करते हैं और आज तक 25 साल से तो हम नॉर्मल सर्जरी कर रहे हैं, इसका ये मतलब नहीं कि हम गलत सर्जरी कर रहे थे. वी वर डूइंग सर्जरी एज वी वर एक्सपेक्टेड टू परफॉर्म टू बेस्ट स्टैंडर्ड्स एज ऑफ दैट टाइम. जब रोबोटिक्स आया है, वी आर एबल टू परफॉर्म सर्जरी इवन फार बेटर देन व्हाट वी इमेजिन वी कुड डू. So every parameter in the knee is dialed in, is customized to the patient, and so we can perform at a far higher level now. It's like flying an aeroplane. Earlier, you had a manual small aeroplane we used to fly. The pilot used to look left, right, and then land how he used to think. Nowadays, you're almost flying on autopilot. And the pilot doesn't need to do a lot. He can customize the plan. He still needs to be there. He still needs to be in control of the aircraft. And then is required for takeoff and landing, which of course are the two most important points of the flight.
जब हम रोबो असिस्टेड सर्जरी के बारे में बात करते हैं तो ऑफन क्वेश्चन कम्स टू माइंड ऑफ द पेशेंट और द रिलेटिव ऑफ द पेशेंट कि कहीं ये रोबोट तो नहीं सर्जरी कर रहा है. तो व्हाट इज द रोल ऑफ रोबो एंड व्हाट इज द रोल ऑफ सर्जन एंड हाउ मच इज कंट्रोल्ड बाय सर्जन वर्सेस रोबो?
हाँ जी. सो जब पेशेंट ऑपरेशन थिएटर में आता है तो सर्जन डज द सर्जरी. वी ओपन द नी जॉइंट. आफ्टर दिस इज डन, वी पुट रोबोटिक पिन्स एंड ट्रैकर्स इनसाइड द नी. उसके बाद में हम एक लाइव मॉडल क्रिएट करते हैं नी का, जो डेटा पॉइंट्स ओवर द हंड्रेड्स ऑफ डेटा पॉइंट्स आर गिवन टू द रोबोट, और वो एक रोबोटिक प्लान बनाते हैं विच इज़ कस्टमाइज फॉर दैट नी. तो वो नी का एक लाइव मॉडल बनता है स्क्रीन पे, विच इज़ यूनिक फॉर दैट पेशेंट. उसके बाद में द रोबोटिक कंप्यूटर सजेस्ट अ ट्रीटमेंट प्लान फॉर दैट पेशेंट. Now, under normal circumstances, most surgeons will follow that plan. Then you will hold that robotic hand saw or the burr, and the robot will complete the bone cuts, but you holding it to make sure nothing goes wrong. After that, you balance the soft tissues and then you fix the parts and you go home. In our situation, we do it slightly different. We personalize the treatment plan, as I will tell you a little later, to give a little better result to our patients so that they have less pain and a faster recovery. So the surgeon is in control all the time. You see the plan, you can modify the plan, adjust the plan, you hold the robotic hand, and then you cut the bone. The robot does the cutting, but you controlling the robot.
करेक्ट। तो रोबोट एक एडवांस टूल है
Yes,
जो सर्जन पूरी तरह से कंट्रोल
control
करता है,
करता है.
और इससे प्रिसीजन भी सर्जरी में बहुत ज़्यादा आता होगा।
Yes, the precision is almost 99.9%.
एक्सेलेंट, एंड दैट मस्ट बी, सो दैट इज द बिगेस्ट
So
बेनिफिट
that is the
ऑफ,
game changer.
दैट इज द गेम चेंजर।
There are other advantages also in terms of less blood loss during the surgery. There is a chance that we might be using less blood transfusions or no blood transfusion to the patient after that. Also, certain steps in the surgery are less. We don't open the femur bone, so there is less chance of a complication called embolism, which is also a complicated matter which can arise in conventional surgery. Also, if you dial in the parameters in the robot and make a personalized plan, there is a faster recovery to the patient. The patient can go home quicker and with less pain.
सो लेंथ ऑफ स्टे अगर हम देखा जाए तो आमतौर पर ट्रेडिशनल प्रोसीजर से कितना वक्त लगता है और रोबोटिक
So
असिस्टेड में कितना वक्त
traditional
लगता है?
stay again, a lot of it is patient control based on the deformity of the patient, the profile of the patient. But on an average, if the stay is about 3 days or so, with the robot you can cut down by a day or so.
So, this is a technical question. So, how do robotic systems handle the variability in patient's anatomy, and how is that accounted for before and during the surgery?
Yes, surgery ke pehle we take different X-rays in different angles. That information is fed into the robotic computer. During the surgery, we use a special tool called a robotic tool, which we run over the patient's femur, tibia bones, and that information goes into the computer. With that, the live model of the patient's knee is created. हर एक पेशेंट का अलग लाइव मॉडल होता है क्योंकि उसके ज्योमेट्री पैरामीटर्स अलग होते हैं. बेस्ड ऑन दैट वो रोबोट एक प्रोग्राम बनाता है कि ऐसे करना है इन द सर्जरी. If you have a different thought, then you customize that treatment plan for that patient. So each patient has an individual personalized treatment plan which is created. When you are doing it non-robotic, you may not have that option of a personalized treatment plan because you only have data to those X-rays, but you will not be able to have dial in those multiple parameters which the robot has access to.
Okay, I think this is very important for patients to also know कि ये स्पेसिफिक प्लान हर पेशेंट के लिए बनता है एंड रोबोट इसमें हेल्प करता है।
Yes, tremendously.
तो इसमें कोई फिर एंग्शियस या टेंशन लेने की कोई बात
Correct.
नहीं है। डॉक्टर, वी विश टू नो मोर अबाउट किनेमैटिक नी रिप्लेसमेंट प्रोसीजर दैट यू परफॉर्म, एंड यू आर वन ऑफ द वेरी फ्यू इन इंडिया हु डज दिस प्रोसीजर्स, एंड यू आर ट्रेन अंडर डॉक्टर स्टीफन हावेल फ्रॉम यूएसए, who is the inventor and pioneer of these procedures. Please tell us more about this.
This is the single technique which has changed recovery after knee replacements is kinematically aligned knee replacement. आज तक the fear about knee replacements has been कि मैं knee replacement कराऊंगा, there'll be tremendous pain, there'll be very slow recovery, और अंत में the knee, though I'm much better than what I was before, may not feel natural. It may still feel artificial. So with this technique of kinematically aligned knee replacement, the knee tends to feel natural after surgery. The recovery is quicker and the pain is much less. The reason is when knee replacements were invented in the 1970s, there was a way of performing them. You had to cut the bone in a particular fashion. Now, when robots have arrived over here, though there's a treatment plan recommended, the plan recommended is also the same as was done 30 or 40 years back, except that it's with enhanced accuracy. So we are following the same plan. So therefore, you're giving accuracy, but the recovery remains the same. Now, with the kinematically aligned technique, the whole game has changed. The idea is to personalize the plan for every patient tremendously. That means you see कि patient का पहले क्या anatomy था, पहले क्या geometry था, before he had the problem, and you give him back his natural knee before that problem occurred. You analyze that, you assess that, and when you give each patient back all his parameters, then only that patient becomes close to normal. So that is called kinematic. That means replacing back the normal motion parameters of the knee. It's a very complex way of doing it, and I'm trained in that. And the robot helps tremendously to dial in all those parameters. And when you do that, the patient has a quicker recovery and he starts to feel his knee as natural.
Absolutely, and this is very important to know because generally क्या होता है, नी रिप्लेसमेंट के बाद अगर वो स्ट्रेट रहा, जस्ट आपने खाली इम्प्लांट डाल दिए तो उसको
Yes,
डिफरेंस महसूस होगा,
correct.
और किनेमैटिकली अलाइन ट्रीटमेंट में he will feel as if it was, it's quite natural.
Correct. It is because it's designed for his knee.
Yeah.
Whereas until now, all knees were done in the same way, whereas all patients are not the same. So that realization has now come.
Good, and we do this.
And we've been doing this now regularly. And we're seeing it already help our patients.
डॉक्टर, आपने एक्सप्लेन किया कि रोबोटिक सर्जरी सेफ है और इसके बहुत सारे फ़ायदे हैं, लेकिन ये जानना भी ज़रूरी है कि कॉस्ट डिफरेंस कितना है। तो व्हाट इज़ द कॉस्ट डिफरेंस बिटवीन द रोबोटिक असिस्टेड सर्जरी वर्सेस ट्रेडिशनल नी रिप्लेसमेंट सर्जरी?
So it also depends on the hospitals which are doing it. Now, in most hospitals, the cost enhancement can be from 60,000 to 1 lakh rupees per surgery. Fortunately, at our hospital, we have kept
Difference. This is
cost
the difference.
enhanced cost of doing
Okay.
the surgery. But fortunately, at our hospital, we have managed to keep cost reasonably low for patients, and our cost increase to the patient is only a small 30,000 to 50,000 rupees per patient, which is very economical. So it's a small jump in cost for a phenomenal increase in the result and to have enhanced accuracy and precision of surgery.
Correct. And like we say in finance, cost and benefit
Yes,
analysis.
the ratio has to be
तो
looked at.
आपकी जो 30 से 50,000 की जो एक्स्ट्रा कॉस्ट है उसमें जो बेनिफिट्स मिलता है वो बहुत
It's
ही
phenomenal.
ज़्यादा है. So I think one should definitely give consideration before opting to traditional versus
That's
robotic assisted surgery. Dr. Pispati, you have been doing knee replacements over last 3 decades now. Tell us ऐसा कोई किस्सा या ऐसी कोई केस जो आपको बहुत स्पेशल लगती है.
No, I'm reminded of a lady who was just 50 years old, a school teacher in a village in Maharashtra, who has the crippling osteoarthritis of the knee. Now, her problem was very unique. She teaches 100 people in her class. It's a village school. She wakes up in the morning, has to take a train, travel to another village by that train, climb railway bridges all the time, and then teach that class and come back. So there are 100 students dependent on her. There is no other teacher in that class. When she got crippled by osteoarthritis, she could not go to the school. So you can imagine 100 people's education has stopped because
My
of that.
God.
Now that's a problem. It's not just a problem for the teacher. There's a problem for 100 children
Students.
and no substitute teacher because we're talking about a village.
Correct.
So nobody else was available. And what is important is she said that I don't want the surgery done anywhere because I don't want 3 months in recovery because my students can't wait for 3 months. तो हमने उन पे वो किनेमैटिकली एंड टेक्निक की और आप विश्वास नहीं करोगे 2 हफ्ते पे शी हैज़ कम टू मी टेलिंग मुझे 0 आउट ऑफ 10 पेन है, कोई भी पेन नहीं है,
Really?
एंड शी हैज़ कम वॉकिंग इन माई ओपीडी फॉर suture removal at 2 weeks without any walking aid, and all the patients in the OPD were shocked to see the way she was walking. they asked आप क्यों आए हैं ओपीडी में? शी सेड 2 हफ्ते हुए नी रिप्लेसमेंट हुआ. पेशेंट्स को विश्वास नहीं हुआ, दूसरे पेशेंट्स को. शी एन ऑपरेटेड केस विद दिस टेक्निक, and at 1 month she was climbing the bridges and the school had restarted.
Amazing.
So
amazing.
that was the experience that she had, and it helped not just her but the other children in the school.
All the students.
So that's why that case was special.
Correct. Excellent. Excellent. So, doctor, I think robotic surgery definitely is the future, and especially knee replacements is there for last 1 decade. Now we have this artificial intelligence, and machine learnings coming in big way. How do you see the future now of robotic surgeries especially in ortho?
तो रोबोट में भी आर्टिफिशियल इंटेलिजेंस तो आ ही रहा है. तो जैसे रोबोटिक्स के केसेस बढ़ रहे हैं, ऑल आर ट्रेनिंग डेटा जो है दैट गोज ऑन टू अ सेंट्रल सर्वर, क्योंकि ऑल दिस डेटा इज सेव्ड. और क्या होता है उसमें कि ओवर द नेक्स्ट 3 or 5 years, राइट नाउ द रोबोट इज गिविंग अस अ प्लान which we are modifying. What we think will happen very soon in the next 3 to 5 years is when you get a plan, it will say that, see, this is the plan which I'm recommending. Then the robot will also tell this is the plan which the top 5 surgeons in USA would do for this knee.
Excellent.
And it will also tell us that this is the plan which 100 surgeons in Maharashtra will do for this knee. And you can then pick and choose also what you want. If you want to go with a US top plan, you can use that, or you can personalize your plan. So that's what it will be able to do for us. So a lot of treatment options will be available.
Yeah, and this will take the precision level to another
level when more and more surgeons data comes in, and the results also come in that way.
Excellent, excellent. So we see a lot of new things happening, and I'm sure I think this will all benefit the patients in a big way.
हाँ जी.
Now we come to the next section of our show, which is rapid fire. Are you ready for this?
Bilkul, yes.
Does your robo get stressed during surgery, or it is always as calm as you?
So actually, a robot is like a yoga master. So it is always calm and super cool. We can't afford to have it packing up on us because we are dependent upon it also to supplement our skills. So it is a yoga master. It's super cool and calm.
Okay, but is he calmer than you?
I would like to think it's as calm.
Really excellent. If your robo had a catchphrase, what would it be?
My robot's catchphrase would be that, Doc, stay as relaxed as me. I got your back all the time. Although I don't do back surgeries, but it still has my back. So if it has my back, I can stand tall and straight in the operating theater.
So, do you ever get jealous of your robot's steady hands?
Actually, the way I look at it is that the robot has good steady hands. The robot gives me precision cuts, but we as surgeons have the skill, judgment, accuracy, and our own steady hands to go along with the robot. So we complement, supplement each other.
Only strengthens,
Yes, it's a harmonious relationship.
Correct, excellent. So, if your robot could give you one piece of advice, what could it be?
But it would be that continue with your surgery. If anything goes wrong, I'm there with you. But nothing will go wrong. You've been doing it for many years.
Excellent. So, you have got good understanding with your robo. Huh? So, if your robo had a personality, would it be more like a precision engineer or surgeon with bad sense of humor?
A precision engineer always. That's what it's designed for.
Okay, I'm sure. I think in future robot could also.
They might even have playlists into them to play music in the
Correct, yeah,
operating
all
theater.
this is quite possible. So, as you said that you have a very harmonious relationship with your robot, so is almost like a friend to you. So, what would be your favorite song for your robot?
I'm reminded of that Amitabh Bachchan movie where he used to say, "Are दीवानो, मुझे पहचानो, कहाँ से आया, मैं हूँ डॉन, मैं हूँ डॉन, मैं हूँ डॉन, मैं हूँ डॉन." So the robot is a don.
So, if Dr. Pispati was not an orthopedician, what would he be?
I've always been fascinated by science and technology, and my second choice was to be a computer engineer. So
Okay.
that's what I would have been. And I had an alternative admission in engineering as well, which I didn't take. So that's what I would have been.
Well, I'm
Possibly I
sure.
would have been at the other end designing robots then.
Yeah, correct. I was just thinking that probably you could have contributed now, to the next generation robot. Thank you, Dr. Ameet Pispati, for joining us today on the episode of Just Health for the people, by the experts, by Jaslok Hospital, and educating us about robotic knee replacements. We hope this session was informative and useful to our audience. Thank you.
Shukriya. Just Health for the people by the experts, an initiative by Jaslok Hospital.
Click the subscribe button on YouTube and stay healthy and stay tuned to Just Health for the people, by the experts, by Jaslok Hospital.